Good morning, everybody. Welcome. Thank you for taking time out of your busy schedule to join us today. We appreciate your attendance, and we do apologize for the late start. Next. This is what we're going to cover. The first part of our webinar, we looked at the subject of attention deficit disorder. So at that time, we looked at the new criteria on DSM-5. We looked at the trajectory of ADHD over the lifespan, and we also looked at such issues as comorbidity and some other areas in the time that we had available. So today I'll quickly review that with you, and then we're going to move into the main part of our presentation today, and that is, how do you treat children that have ADHD? What are some of the behavioral treatment highlights? And my colleague, Chris Huzinec, is going to review that with you, along with the school-based interventions. We're going to move into the subject of assessment. We're going to look at rating scales, task-oriented tests, and how to link interventions to assessment, and then also how to monitor the progress. Next, please. So, some time ago, our colleague, Dr. Russ Barkley, defined ADHD in the following way. He said that it's a developmental disability, and it is in the domains of sustained attention, impulse control, and it requires the regulation of activity level to situational demands. And as Barkley has maintained since that time, part of the problem that children with ADHD face is how can they regulate their behavior, how can they manage their performance, and how can we help to set up a structure for them to assist them in that area. Next. So these are the three core symptoms. The symptoms include inattention, which involves the ability of a child to maintain task persistence, and this is an area where they have great difficulty. They have trouble sustaining focus, and they appear disorganized. They are seen to move around constantly and often fidget, tap, talk excessively, and what we see in adults is that this then becomes restlessness and sometimes distractibility and intrusion. Also, we see signs of impulsivity, where the person may act first without thinking and not pay attention to the consequences of their behavior. So that person may appear to be socially intrusive and interrupting to others. Next. These are the symptoms that we reviewed last time. It's important to recognize that these are also symptoms that we see in normal children. So what we may see sometimes in very young children is they have trouble sitting still or playing quietly. They may be easily distracted. However, it's important to recognize the symptoms of ADHD are more severe, they occur more often, and they adversely impact the behavior of children. It reduces the quality of how they perform. And we know it changes over time. So in preschoolers, we'll often see symptoms of hyperactivity. That may go away as children go through school, but those same symptoms of inattention, distractibility, impulsivity persist. Next. So the question is, how do we treat children that have this disorder? We know, according to Russ Barkley, that really it boils down to trouble regulating behavior, monitoring their performance, and this is more of an executive dysfunction. And so at this point, I'm going to turn it over to my colleague, Chris Huzinec, who's going to review with you how do we treat children that present this way. Chris.
Thank you, Peter. Good morning, everybody. Thank you for being with us today. In this section, I'm going to be talking about some of the treatments that can be used with children with ADHD. According to the National Survey of Children's Health, we know about 9 9% of children between the ages of 2 to 17 have been diagnosed with ADHD. We also know that more than 2/3 of those students with ADHD are currently taking medication as a form of treatment. In the last webinar, we did an overview of the use of medication with students with children with ADHD. While medication has been found to effectively reduce behaviors associated with hyperactivity, inattention, and impulsivity in many children, it is not effective for all children, and many parents have reservations about its use. Additionally, medication does not address some of the related social, emotional, and behavioral areas and skills that may not have developed at the same level for these kids as their same age peers. Therefore, other treatment options should be explored.
Excuse me, Chris?
Yes.
Can you hold the phone a little closer? Or turn up the volume?
Hold on. Is that better?
Yes, thank you.
Okay. All right. I apologize for that. In 2001, the American Academy of Pediatrics published a practice guidelines for the treatment of school-age children with ADHD. In 2011, they updated these guidelines. The AAP recommended the following: that we establish treatment programs that recognize ADHD as a chronic condition, that there should be a collaboration with clinicians, parents, children, and school personnel, that stimulant medication and/or behavior therapies should be used as treatment. If a child has not met their treatment outcomes, clinicians should evaluate the original diagnosis. Also, they should evaluate the effectiveness of the treatments that were being used and also look for other coexisting conditions. And finally, they recommend that periodic systematic follow-ups be done with the child, monitoring their progress towards target outcomes. Here are several of the treatment methods that they identified as being effective with children with ADHD. Of course, medication, which we've discussed previously in the earlier webinar, behavioral treatments, school-based interventions, cognitive training and rehabilitation, and a multimodal method, which may include one or more of the treatment types. The AAP recommends that in their 2011 white paper that the treatment plans be developed with consideration for age. Specifically, children preschool ages 4 through 5 should be first treated with behavioral and parent-based treatments before the introduction of medications. For elementary school age children, medications should be combined with school-based and behavioral treatments. And then for adolescents ages 12 through 18, approved medications for ADHD should be used with adolescents, as well as combined behavioral therapies and school-based interventions. The AAP also recommends that a group approach towards the treatment be used in terms of different professionals providing different types of options for the treatment of ADHD in children. So child and adolescent psychiatrists should work with the team in order to diagnose ADHD and prescribe medications. Psychologists can work to diagnose ADHD, provide talk therapy, and help people with ADHD explore their feelings. Cognitive behavioral therapists can set up behavioral modification programs at school or in the home, establish concrete goals for behavior and achievement, and help families and teachers maintain rewards and consequences. And then educational specialists can work with teachers to provide them with techniques on how to help students in the classroom and school environment. In this next section, we will discuss some of the behavioral treatments that can be used to help children with ADHD. William Pelham, in his book, Psychosocial Interventions for ADHD, identified 5 specific categories of behavioral treatments. The first category, cognitive behavioral interventions, involve the goal of this treatment, a form of treatment, is to teach the child self-control through verbal self-instruction, problem-solving strategies, cognitive modeling, self-monitoring, self-evaluation, self-reinforcement, and other strategies. Typically, a therapist teaches the child through modeling, role-playing, and practicing cognitive strategies. The child can use these strategies to control his or her attention and impulsive behavior. The second category is clinical behavioral therapy. The goal of this form of behavioral treatment is typically to train parents, teachers, and other caregivers to implement contingency management programs with children. Parents generally attend parent training programs where they are given assigned readings and instructions in how to use behavioral techniques. Therapists often use clinical behavioral therapy with teachers in a consultation model to teach behavioral strategies for application in the classroom. The use of daily report cards to collect information about the child's behavior are often used. Also, tokens or points for certain targeted behaviors in the classroom are often also employed. The fourth category is contingency management. Contingency management is a behavioral treatment that involves a more intensive program of behavioral modification. Typically, this type of program is implemented in specialized classrooms. And the next area is intensive behavioral treatments. Intensive behavioral treatments focus on using behavioral therapy with contingency management in an intensive program to improve the self-control and socialization of students or children with ADHD. And then finally, Pelham recommends that we combine behavioral interventions with medication to get the most effective treatment results. Okay, research shows that behavioral therapy is an important part of treatment for children with ADHD. ADHD affects not only a child's ability to pay attention or sit still at school, it also affects their relationships with family and others. Children with ADHD often show behaviors that can be very disruptive to others. Behavior therapy is a treatment option that can help reduce these behaviors. The goals of behavior therapy are to learn and strengthen positive behaviors and eliminate unwanted or problem behaviors. Behavior therapy can include behavior therapy for training for parents and behavior therapy for children, or done in combination. In parent training in behavior therapy, parents learn new skills or strengthen their existing skills to teach and guide their children and to manage their behaviors. parent training in parent therapy has been shown to strengthen the relationship between the parent and the child, and to also decrease some of the negative behaviors that the child is exhibiting. Within behavior therapy, parents learn how to communicate positively with their children, how to use positive reinforcement, and how to improve their use of discipline and structure within their home. Along with setting guidelines for therapists and teachers and how to address ADHD students and children, the American Academy of Pediatrics also provides some advice for parents. Specifically, they provide 3 basic principles that parents should use when they're assisting the treatment of their children who have ADHD. The first one is to set specific goals. The second one is to provide rewards and consequences. And the third is to keep using rewards and consequences in a consistent manner. Okay, in 2008, Fabino and Pelham and their associates conducted a meta-analysis of behavioral treatments for children with ADHD. In that meta-analysis, they looked at 174 studies of behavioral treatments that were identified in 114 individual papers. They looked at the effect size of the effects or impact that these treatments had on students. And overall, they found that when they looked at studies that were between group studies, there was a strong effect size of 0.83. For those pre-post studies that they reviewed, they also found a strong effect size of 0.70. And then within group studies, which we would expect higher effect sizes because of the lower number of students and children included in the study, they found that there was a 2.64 effect size, again, a strong effect size for that type of study. This indicates that behavioral treatments are highly effective. Based on these results, there's a strong and consistent evidence that behavioral treatments are effective for treating ADHD. All right. In the next section, I'm going to look at treatments of ADHD that are used within the school and in the classroom. According to the National Survey of Children's Health, which interviewed parents, reported that the prevalence of ADHD among children ages 2 through 17 is 6.1 million children. About 380,000 of those children are ages 2 through 5. 2.4 million of those children are ages 6 through 11, and 3.3 million of those children are adolescents ages 12 through 17. Again, so we have a large contingency of students in our schools who have ADHD and require extra support in order to help them flourish and meet their potentials within the educational system. Now, under the American Disabilities Act, often these children are identified through Section 504. In order to qualify for Section 504 services, there must be evidence of an existence or identified impairment that limits the major life activities of a student. having a diagnosis of ADHD alone is not enough to qualify for accommodations under 504. So there are some students who are in our schools who, while being diagnosed with ADHD, may not be receiving specific services under the 504 Act. And while parents report that 9 out of 10 of these students receive supports or accommodations at school, most of these accommodations focus on improving academics without directly addressing the student's behavior or attentional needs. The National Association of School Psychologists recommend that for students with ADHD, that there be instructional strategies to help improve the management of behavior and social and emotional supports, that supports for teachers be provided to improve classroom management, that the collaboration and consultation with families be used to align efforts and promote consistency, and that there should be consistent and continual monitoring of interventions to ensure integrity of the implementation of those interventions, and that education of staff and parents in characteristics and management of ADHD, as well as the continual communication of advances and supports be provided. Also, that when special education is required, that students are facilitated and given the proper support. Also, that collaboration with community agencies and professionals providing medical and related services to the students and their families. And then finally, individualized behavioral support planning for students when necessary. As I previously mentioned, many students with ADHD are not directly identified or supported within special education. But in current practices in education, specifically in response to intervention for behavior or in multi-tiered systems of support or with positive behavioral interventions and support, there are ways to support students, all students, with behavioral and attentional issues within the school and in the classroom. Okay, at the universal level, we've found that many teachers have often asked for more support in being able to manage, train, more support and training into improving the way that they manage their classrooms. Specifically, surveys by APA and by the MetLife Teacher Survey, we have found that that the need for more training and help in classroom management heads the list of the things that teachers are asking for. So at Tier 1, in a multi-tiered system, it's important to provide teachers with all teachers with training in the essential elements of a well-managed classroom. Some of the things that are involved with are some of those elements include showing teachers how to better teach behavioral expectations, how to develop procedures and routines, how to use reinforcement and acknowledgement in the classroom, and then how to improve the teacher-student relationship or interactions, how to structure the learning environment, and then when disruptive behaviors occur, ways that they can correct that behavior and strategies to support the students who show those behaviors within the classroom. Now, at Tier 2 and 3, more group and individualized supports can be provided. Many of these supports focus on modifying the academics instructional practices so that they better support students who are showing attentional and hyperactivity and disruptive behavior. They can have modifications of the classroom environment in some ways in which that they can set the classroom up so it best supports students who are impulsive or easily distractive. They can also include group and individual strategies for improving social interaction, and then additionally use contingency-based behavioral systems to provide reinforcement for positive behaviors that those students.
Chris?
Yes.
Just a comment here that sometimes we find parents get frustrated because they may go to their pediatrician and say, my child has these problems. The pediatrician then diagnoses an attention deficit. They go to the school system and they think, okay, now he qualifies for services because he has this problem. And what you just pointed out is they may not qualify for special ed. They may not qualify for Section 504, but that doesn't mean that at Tier 1, the teacher doesn't require some support and help or guidance in shaping a child's behavior and reinforcing appropriate behavior. So I think it's appropriate to say, yes, you can screen at Tier 1, and certainly there may be some classroom behaviors and exercises that may be important for the teacher to learn about in order to be able to manage that child in that setting. Would you agree?
Yes, and I think that's part of why we're looking at supporting behavior, because it's not for all students, but then also specifically for those attention deficit students who are not identified, that they still can get support based on the specific behaviors that they're exhibiting within a multi-tiered system. So within a multi-tiered system, often screeners are used to identify the specific behaviors that a student may be exhibiting that is causing disruption within the classroom. And action can be taken to support those students to improve their behaviors, not only by using specific interventions and specific strategies, but also by setting up an environment that proactively teaches behavioral expectations to all students and provides teachers with the tools that they can better manage their classroom. In DuPaul's study in 2011, he identified some effective intervention strategies that can be used in the classroom. He identified behavioral interventions for students, which include both antecedent and consequence-based strategies. Self-regulation interventions. Students with ADHD are encouraged to monitor, evaluate, and/or reinforce their own behaviors. Academic interventions in which teachers mediate and direct instruction in relevant relative skills that require remediation. Also, home school communication programs, which can include the daily behavioral report card, which provides specific behavioral objectives for the student to complete not only at the school but also at home. And then interventions addressing social relationships and difficulties. And then finally, that this be done in a team effort that's collaborative, so that we can work with the teachers, the school psychologists, and also the parents in developing interventions and programs to support ADHD students.
Chris, can I make a point, please?
Yeah. Yes, you can.
A few years ago, I was involved in a study at Mass General Hospital in Joe Biederman's clinic where he was looking at ADHD. And one of the studies we reviewed was how frequently are children with ADHD held back. And this was held in Massachusetts, so it may not apply around the country, but it was important to recognize there are increased risk, not just for having some academic problems, but for also being retained. And so just anticipate that part of our job is to help them to be successful in each of the grades that they're going through, and to try to remediate some of those academic weaknesses that you pointed out, because this was a risk factor, and this was a study that we presented at the American Academy of Child Psychiatry. At the time, I think people realized there was a practice around the country to not allow children to be promoted if they hadn't achieved a certain academic level. But what we found was there was a far greater risk of these kids never graduating from high school because they've been held back too much. Thank you.
All right. Thank you, Peter.